Students, today we will continue our topic, that is histamine. In the last lecture we studied about its pharmacological actions. Now today we are going to study about its absorption, excretion and its uses and adverse reactions of histamine. So let us start with first absorption. Histamine is well absorbed on intramuscular and subcutaneous injections. Subcutaneous injections. When giving histamine through intramuscularly or subcutaneously, it is well absorbed in our body. However, oral absorption, through oral route, absorption is poor. There is poor absorption. So oral route is not recommended in case of histamine. It should be given either intramuscularly or subcutaneously where it is well absorbed. Now coming to this is the absorption. Now coming to the metabolism of histamine. In our body, metabolism. In our body, histamine gets converted into methylhistamine. Which further gets converted into L-methyl imidazole acetic acid. Histamine first gets converted into methylhistamine, which further gets converted into L-methyl imidazole acetic acid in presence of an enzyme that is known as imidazole N-methyl transferase. This is the enzyme which catalyzes this reaction. It converts the histamine into first methylhistamine, then into imidazole acetic acid. Methyl imidazole acetic acid is easily excreted in the form of urine. So this was the metabolism. Now coming to the adverse reactions. Histamine shows number of adverse reactions. These include number first, hypotension. Number second, headache. Number third, visual disturbances. Dyspnea. And diarrhea. The common adverse reactions which are observed with histamine are hypotension, headache, visual disturbances, dyspnea and diarrhea. Now uses of histamine. Histamine has no therapeutic use. Then for what it is then used? It is used for diagnostic purposes. It is used for the study of gastric acid secretion. where we have to perform the study on the gastric acid secretion, we use histamine. And another use is in case of leprosy patients. Leprosy patients. In leprosy patients, there is an absence of triple response. Absence of triple response. Such patients fail to show triple response of histamine. So it is their user whether they do possess a triple response or not. So histamine on its own has no therapeutic use, but it is used in the diagnostic purposes, like in the study of gastric acid secretion and leprosy, in confirming whether the triple response is present or not. Another disease where it is used for diagnostic purposes is pheochromocytoma. Pheochromo. Another use is it is pheochromocytoma. Pheochromocytoma. It is a tumor of the adrenaline gland where it is used for as diagnostic purposes. So this was the uses of the histamine. Now, preparation of histamine. It comes in a preparation that is known as histamine acid phosphate. Histamine acid phosphate. It is an injection. It contains 1 milligram per ml. So this is the preparation or this is the common preparation which is present in the market, that is histamine acid phosphate. It comes in the concentration of 1 milligrams per ml. So this was the uses of the histamine. Now we will study about anaphylaxis. Anaphylaxis. What is anaphylaxis? In our body, sometimes the foreign substances get entered into our body. Foreign substances. Sometimes. Our body sometimes get exposed to a foreign substance which we call as antigen. So our body shows the response in stimulation of the antigen. Our body starts secreting antibodies. In response to the stimulation of the antigen, our body secretes antibodies. These antibodies remain circulating in our blood. So with the second exposure of the same foreign substance in the body, after some time, starts on the second exposure of antibodies of antigen in our body shows reaction, that is, it starts combining these foreign substances and antibodies. On the second exposure, there occurs a reaction between foreign substance antigen and antibodies. On the second exposure of the antigen in our body, it starts combining with the antibodies which are present in our body, which do circulate in our body. It results in a reaction that is known as an anaphylaxis. Anaphylaxis is a shock-like stage in which there is the damage of mast cells. There is a damage of mast cells, which leads to the excessive secretion of histamine. excessive secretion of histamine. So, anaphylaxis is the shock-like stage in which our body's mast cells gets destroyed and there is the excessive secretion of the histamine, which causes certain effects like number first, severe hypotension. Severe hypotension. Severe hypotension. Number 2, bronchospasm. And number 3, laryngeal edema. So, in an anaphylaxis stage, the patient suffers from severe hypotension, bronchospasm, and laryngeal edema because the body is exposed to the antigen which combines with the antibodies that are present in our body in response to this foreign substance, which results in the damage of mast cells and the excessive release of histamine. Excessive release of histamine causes severe hypotension, bronchospasm, and laryngeal edema. This stage needs an immediate treatment because otherwise the patient can go to death. These symptoms can cause death to the patient. This reaction is called as an anaphylaxis. Thank you.